Hello there and welcome to our Module 1 training number 10. Here we are going to discuss how it interacts with other medications, lithium level, side effects, toxic side effects, all things you should know about lithium. So let's get started with this training. This is our roadmap to success, understanding lithium and its implications or interactions. So, important to know what your levels of toxicity starts at. It starts at 1.5 or higher. Lithium has a low therapeutic index. As you can see, the normal values are zero point 0.5 to 1.2. So it's a very low, narrow window for us practitioners to make a mistake. So it's very important that you understand the normal levels of zero point 0.5 to 1.2. It's the standard treatment for manic episodes, at least for the board. It is the standard treatment for manic episode for the PMHNP board certification because it has reduced suicidal ideations for those with manic symptoms. It calls a neuroprotective treatment of choice for bipolar disorder. I really want you to memorize and know these 5 facts about lithium. Okay? They'll come up over and over again. Now, when prescribing lithium, there are certain labs that you need to follow. That's your thyroid panel, TSH. Why? Well, basically, high lithium levels, it mimic the manic episode, right? And hyperthyroidism, it's similar to that, to the manic like episode, hyperthyroidism. Your creatinine, which is zero point 0.6 to 1.2, as you notice, the creatinine level is the same level as the lithium, the number wise. Okay, so there's one thing less to memorize. Creatinine, zero point 0.6 to 1.2, lithium level, the same thing. Okay, you need to monitor your creatinine because lithium is taken out the body by the kidney, and creatinine and BUN has to do a lot with the kidney function, right? So it reflects the kidney function and the lithium levels. Blood urea nitrogen or BUN, that's 10 to 20. And before you prescribe lithium, or in fact, before you prescribe any antipsychotics, any mood stabilizer for females age of 12 to 50, you need to get a um, pregnancy test, or known as HCG. And for those over 50 years old, you need to get an EKG. So lithium will cause some side effects. And that's important to distinguish between lithium side effects, somewhat expected that we can manage, to lithium toxicity. That becomes more complex management. So, what are the lithium side effects? It can cause hypo, not hyper. It can cause hypothyroidism, can cause weight gain, central nervous system defects, fine hand tremors, right? They are invisible. They are fine hand tremors. That is side effect. If they become coarse, it is no longer a side effect, but it is now a toxicity level. So if it's coarse, is it a toxicity? Not fine. So fine hand tremors, right? You can see So that means a side effect of lithium. Fatigue, mental confusion, a headache, coarse hand tremors, which is a sign of toxicity, right? Not exactly a lithium side effect. Nystagma of the eyes, a maculopapular rash or itching, acne. It's a side effect of lithium maculopapular rash. Okay. GI symptoms like diarrhea, vomiting. Anytime you see symptoms that says severe, so you know you're no longer a side effect of the medication, but a toxicity level. Okay. Cardiac issues often produce a T inversion, and dysrhythmia, and hematologic issues like leukocytosis. Okay, definitely know the side effects of lithium. Now, when it becomes toxicity, uh, it's kind of like becomes severe, right? It does become severe. So you have severe nausea, vomiting, diarrhea, confusion, drowsiness, blurry vision, or slurred speech, muscle weakness, ataxia, and coarse hand tremors. Okay, so patient may develop a difficult walking, right? Ataxia. They may lose their balance because they are in severe or toxicity level of lithium. Okay. So actions in case of a toxicity. What are you going to do? In case of any toxicity, any drug, the first thing to do is to stop the drug, stop the lithium. Next, check the lab values. Okay. That's your action, that's your priority. Now, how lithium interacts with the other medication, it's so very important. Earlier, we had mentioned that lithium interaction with anything that prevents the excretion of a salt, right? It will anything that prevents excretion, right? So, but therefore, it will retain lithium if excreting plus excreting sodium. So, it do an exchange between lithium and salt. So, the lithium will go high, the salt will go down, be hyponatremia, patients on lithium, right? While keeping elevated lithium levels if they take with anything that's high for hypertensive, like thiazide diuretics, right? NSAIDs, ACE inhibitors, angiotensin 2 blockers. So know that ACE inhibitor and angiotensin 2 blockers, they are for heart conditions, especially cardiac conditions that has to do with volume control. Okay, volume control. So questions that ask about ACE inhibitor, ARBs, they will increase lithium level, and SAIDs will increase lithium level. So you have to manage this accordingly. Okay. Just again, a quick review. We just went over this. Glutamate, GABA, calming, adrenaline is concentration, acetylcholine is your learning memory, dopamine is for pleasure, rewards, glutamate is for your memory, serotonin is your mood, and then endorphins that we described earlier. Just a review of neurotransmitters. Checking on learning. You have a 46 years old patient with bipolar disorder arrives at the routine follow-up appointment, worried about severe vomiting, diarrhea, muscle weakness, blurry vision, and ataxia. The, the patient currently takes 1,000 milligrams of lithium per day. What action should the nurse practitioner top priority be? A. Keep the patient on the current regimen since they are stable and continue monitoring them. Request an electrocardiogram. instruct the patient to discontinue lithium usage and arrange for a lithium level, or D, measure the patient's vital signs? Well, if you picked C, instruct the patient to discontinue lithium usage and arrange for a lithium level test is the right answer. Okay, patient safety first. By discontinuing the lithium, even if you don't have the labs, it's totally okay because you have the symptoms of toxicity present. Okay. Now, another thing that has to do with lithium that often comes up on tests is what kind of a lithium birth defect it can cause, right? It can cause a heart defect on the baby, obscene heart condition. So be on a watch out. We'll cover more on that on the upcoming slides. Let's finish this module and move on to module 11. See you there.